And now we will listen to Professor Ahmed Adil. He will talk us about DNA fragmentation before EGSI.
بسم الله الرحمن الرحيم. طبعا أنا بشكر دكتور هشام جابر على المؤتمر العظيم اللي احنا موجودين فيه دلوقتي. بشكر دكتور حامد عبد الله رئيس الجلسة ودكتور أسعد الشيمي، وبشكر أساتذتي دكتور عمرو مليجي ودكتور شريف غازي ودكتور طه. التوبيك اللي هنتكلم عليه النهارده هو DNA fragmentation tests. أنا أحمد عادل lecturer of andrology, sexology and STDs, Cairo University. الكويستشن اللي هنقوله دلوقتي ده بنتمنى في آخر البرزنتيشن نكون وصلنا الإجابة ليه. Is the use of DNA fragmentation tests of any value in managing infertile couples? This is a multiple choice question. Should we ask for DNA fragmentation test routinely in any couple requiring fertility? Is it yes or no, or in certain cases? We'll first talk about the sperm chromatin structure. During the later stages of spermatogenesis, spermatid nucleus undergo remodeling and condensation. Histones are displaced by transition proteins and then by protamines, which are more basic and much smaller. The DNA strands are tightly wrapped around their protamine molecules, forming tightly and highly organized loops. Enter and intramolecular disulfide crosslinks between protamines leads to compaction and stabilization of the sperm nucleus. This compaction protects the sperm from the external stresses. The sperm nuclear proteins are predominantly protamines, representing 85%. Histones represent nearly 15%. The histone-bound DNA are less tightly compacted when the strands are not packed. ممكن نستنى ممكن لغاية يخلص النشيد أو نغني معاهم يعني عشان ما تتفهمش غلط بس إن أنا مكمل والبتاع. Right. Histone-bound DNA are less tightly compacted. When strands are not packed well, DNA strands becomes more susceptible to damage, leading to DNA fragmentation. What are the causes of sperm DNA damage? We can classify them into intrinsic factors and extrinsic factors. Intrinsic factors as remodeling and packaging problems, protamine deficiency, and excessive reactive oxygen species. Extrinsic factors as chemotherapy, smoking, infections, varicocele, and hyperthermia. Concerning the intrinsic factors, remodeling and packaging problems, transient DNA strand breaks are introduced during spermiogenesis. These breaks are needed for transient relief of torsional stress. These physiological breaks, if not repaired, will lead to DNA fragmentation. Concerning protamine deficiency in infertile men, there is increase of histone to protamine ratio. Such deficiency will lead to defective compaction, increasing the susceptibility to DNA fragmentation and leading to defective spermiogenesis. Excess reactive oxygen species. Reactive oxygen species have an important physiological role, but when an imbalance between the production of the reactive oxygen species and the ability of the antioxidants to scavenge them, an oxidative stress occurs which leads to DNA damage. Regarding the extrinsic factors, such as radio and chemotherapy, they induce sperm DNA damage directly by lowering the activity of the DNA topoisomerase, or indirectly through changing the hormonal profile and reducing the antioxidant production. Regarding varicocele, varicocele leads to DNA damage through the varicocele-induced hyperthermia and excess production of ROS. A meta-analysis of 7 studies, including 336 patients, indicated that the DNA fragmentation index is significantly decreased after varicocele repair. This diagram shows us the results of fertilization, live births, and also miscarriages in a microsurgical varicocele repair prior to ICSI and ICSI without treating the varicocele. Of course, it was concerning fertilization and live births, it was higher in the varicocele repair group, and the miscarriages were more in the group with untreated varicocele. The differences is attributed to an improvement in the DNA fragmentation. This diagram will show the difference in DNA fragmentation between testicular sperms and ejaculated sperms. Of course, it is lower in testicular sperms and elevated in ejaculated sperms. Now, what's the types of DNA damage? We have single-stranded breaks, which is easy to repair with better prognosis, and double-stranded breaks, which is more serious and has a deleterious effect. What are the consequences of high DNA fragmentation index? It will lead to a male infertility, unsuccessful IUI and ICSI, impaired rates of fertilization, whether in vivo or in vitro, arrested embryo development, miscarriages, and dominant genetic diseases. How? oocytes and early embryo have the ability to repair sperm DNA damage. Fertilization is independent of DNA damage, but post-fertilization development is affected by the improper repair by the oocyte, which occurs if the DNA fragmentation was high, leading to implantation failure and early miscarriages. Now, what are the types of diagnostic tests, DNA fragmentation tests? We have the COMET, which is a single-cell gel electrophoresis, the tunnel, terminal deoxynucleotide transferase mediated, UTP neck-end labeling. The most commonly used test is the sperm chromatin dispersion test and the sperm chromatin structural assay. All of these tests detect single or double-stranded DNA breaks. COMET and tunnel detect an existing damage, while other tests can detect the potential future damage. The unit of measurement of DNA fragmentation is the DFI, or DNA fragmentation index. The sperm chromatin dispersion test has a cutoff value of 23%, which is the most commonly used test. Samples with assays results above the threshold percentage are considered to have high DNA fragmentation. This is a picture of the kit of the Halotech, which is used for sperm chromatin dispersion test. And this is a slide showing the difference between the sperms with high DNA fragmentation and others with low DNA fragmentation. The one with a halo represents the sperm with high DNA fragmentation, while the one with no halo represents a good sperm with compacted DNA. DNA integrity and spontaneous pregnancy. Spontaneous pregnancy chances are reduced when the DNA fragmentation index is higher than 30%. More than 30% of men, that's a very important point, more than 30% of men with normal semen parameters will have a high DNA fragmentation. Of course, also patients with oligoacid teratospermia, chances of increased chromatin damage is high. Concerning ICSI, a meta-analysis of 16 studies and 2,969 couples shows increased miscarriages in couples undergoing ICSI with high sperm DNA damage. In patients planning to undergo IVF or ICSI, the impact of elevated DNA damage is tremendous. It would affect the embryo development or the implantation, and this may lead to miscarriage. Now, this, I can consider it the most important slide in the presentation. When to ask for a DNA fragmentation test? In the following cases: couples with prolonged idiopathic infertility, history of repeated abortions, low fertilization rate or implantation failure in ICSI, exposure to environmental toxins, patients with varicocele, advanced age of the male partner, and subnormal seminal parameters. Why we should postpone ICSI if the sperm DNA fragmentation is high? This will avoid the loss of the valuable biological time, the cost of the failed cycles, and of course the socio-psychological stress following the failed cycles. And it will increase the success rate of ICSI after treating the underlying cause. In conclusion, successful human reproduction depends on the integrity of the sperm DNA. There is a threshold for sperm DNA damage beyond which embryo development and pregnancy outcome are impaired. Spermatozoa of infertile men possess more DNA damage than that of fertile men. Sperm DNA fragmentation tests provide additional information about sperm quality and the ability of a couple to conceive. The use of these tests as a diagnostic and prognostic tests improve the result of assisted reproduction, especially in cases with repeated ICSI failures. Thank you.
نشكر الدكتور أحمد عادل على المحاضرة الهامة في استخدام الدي ان اي فريجمنتيشن في الريبيتد اكسي فيلير، بالذات في الريبيتد اكسي فيلير.